Yeah, so also we talked about ototoxicity. So this is again is due to cisplatin exposure and it is dose dependent, which means those patients who got more cycles or had more exposure are going to be more prone to having this. So it can manifest, like I mentioned, with hearing loss, usually in the high frequency ranges, and this occurs about 18% of individuals. Tinnitus occurs from the damaged inner ear hair cells. And it also has an association with hypertension, hypercholesterolemia, smoking. And it is notable that hearing loss can improve and may improve over time, even after you've finished your chemotherapy. Again, like modifiable risk factors are going to be controlling blood pressure and also avoiding other noise exposures. These all increase your risk for hearing loss. In terms of neurotoxicity, again, this is mainly due to the cisplatin and it is dose dependent. Like we mentioned, this is peripheral neuropathy, which is that pain, numbness, tingling that can occur in your fingertips and toes. It occurs in 20 to 40% of individuals, but up to 30% of people will have residual neuropathy 5 to 10 years after completing their treatment. So some modifiable risk factors again include smoking cessation, not drinking excess alcohol, and unfortunately, but sort of interestingly, there's also a genetic component that may predispose some individuals more so than others to getting neuropathy and having worse neuropathy. Is there anything else that I missed, Karan?
Yeah, I think a few things I would like to add. So, just for simplicity, ototoxicity just means hearing issues. The hearing issues, as you mentioned, can go from sensory neural hearing loss, meaning you can have high frequency sounds that could be difficult to hear. The same thing with tinnitus. Tinnitus just means a constant ringing sensation in your ears. It can start from a low frequency sound, but can also get worse and worse over time. We try to get audiometric testing for our patients as much as possible prior to starting the medication. If not possible, we definitely get it at least once every 3 to 4 years to make sure that they are catching up on that. In terms of neurotoxicity, while peripheral neuropathy or nerve injury is the most common, it starts peripherally in your fingertips and in your toes, and then it moves up over the course of time. Another factor is neurotoxicity, means brain toxicity to the brain or brain related organs, meaning spinal cord or the nerves. Um, in neurotoxicity, there is long-term association, or some patients can have sort of issues with recall, issues with executive function, meaning they might have some slowness that they did not have before starting chemotherapy, and that can be about 20%. So every 1 in 4 patients, or 1 in 10 patients, can have these kind of issues as well. So just wanted to make you aware as well.
Yeah, I mean, obviously these are very disturbing when they happen, but I know I have seen patients through in clinic where these side effects did resolve with time. So it is possible that they will.
Mm-hmm. That
Mhm.
is correct. That is correct. As I said, they do resolve over the course of time, but this is something that could be an adverse event or adverse side effect of your chemotherapy.
Okay, and then I mentioned Raynaud. So this is vascular damage, usually from bleomycin. It develops in 18 to 39% of individuals within the first 4 to 12 months, and about 25% of cases will last years later, up to 20 years later, although it's usually very mild. Then we also spoke about nephrotoxicity. So this just means kidney injury. Again, there's a dose-dependent relationship with many of the chemotherapies that we talked about. Often, and luckily, the kidney function does seem to rebound a couple years after stopping therapy. But there are individuals who do have a risk of developing lasting kidney disease or chronic kidney disease, especially after receiving BEEP. And this occurs about 12 to 23%. And I really want to highlight the risk of pulmonary toxicity. And I know Karan mentioned this a little bit before, but this is related to bleomycin exposure. And at the earliest sign of pulmonary toxicity, the bleomycin should be discontinued and stopped. So toxicity from this drug ranges from having pulmonary fibrosis, which can be caught on imaging, blood clots in the lungs, pneumonia, and other lung diseases. Other risk factors that may predispose individuals to getting this toxicity are a long history of tobacco use, as well as cisplatin exposure. Is there anything you'd like to add here, Karan?
No, I think you did great.